So, Provost McCauley, first of all, it is such a joy to spend even a couple of minutes with you. And I'll just take a second to say thank you for the tremendous role model and influence you've been on my career. And thanks for the chance to speak with you. You're a clinician at heart. You've been a dental hygienist first, then a general dentist, periodontist. You got a PhD along the way. What skills and experience do you draw from your clinical career that serves you now as the provost at University of Michigan?
Well, thank you, Dr. Nalia, for spending time with me. It's always delightful to converse with you, so thank you. Actually, I think it's really interesting when you think about dentistry as a whole, and people are not surprised to know that a knowledge base is really critical, a biomedical knowledge base. People understand that technical skills are critical. But I think one of the aspects that people tend to underappreciate is how important behavioral science is in dentistry. And I think that would be the area that I really draw on in my current role. So when I think about this, I think about the fact of how important it is when you're treating patients to have trust, or for the patient to have trust in their provider, respect, and empathy. And those are three aspects that are really critical in my position as provost, or really any leadership position. So let me give you a few examples. So you mentioned that I was a hygienist. You know, my father was a general dentist, and I was a dental assistant in his office before I went through dental hygiene. And I distinctly remember, he being a role model for me and how much I learned from how he interacted with patients and how much attention he spent to connecting with them. And that I've always really tried to emulate in my father. It was helpful in a clinical practice. It's also helpful in my day-to-day work now with faculty, students, deans, other campus leaders. I'll also say I had the great opportunity to practice for many years and to have a faculty practice here on our campus. And one of the things I really remember enjoying was many of my patients were faculty here. So I actually learned a lot about other schools on our campus through the patients that I treated. And that has helped me in this role, just getting to know other units and the fact that, they all have kind of unique cultures. And then the other thing I'll say is in the context of teaching in our clinics, how important communication is and how the communication has to be really strategic. You know this because I know you teach in the clinics a lot. Being with a patient and a student at the same time and knowing that you have to communicate with both of those individuals, and you have to be able to communicate with the student to help them garner their skills, to develop their practice, while also respecting the patient and being able to deliver sometimes challenging communications to the student in front of a patient is a really distinct skill set. And I think those experiences have been really impactful for me, in my current role, developing skills of empathy, respect, and being able to develop the subtleties, the nuances to be able to communicate with multiple different people who are presenting, with their own individual concerns, desires and aspects of who they are in the patient setting. So I think the behavioral science part has been really helpful to me. The one thing I will say is being a clinician did not give me the experience to do interviews like this. It didn't give me the experience to talk in front of 35,000 people in the big house for graduation, but it did really help me at the one-to-one conversations that are so critical to day-to-day work in the provost's office.
There's a lot of dentists rising to provost now. Jerry Bradley at Louisville, Carol Ann Murdoch-Kinch served a term as interim provost, so those skills are rising to the fore, I guess.